I was born in a little town on the border of Texas called Laredo, but my parents are both from Monterrey, which is a big city in northern Mexico. My parents came over when they were when their 20s, right out of college, and settled in right on the border. And so my entire family still lives in Monterrey, Mexico. My role here at Cigna is the Director of Client Management. I have a staff of 6 client managers who their job is primarily to keep our clients happy, let them know how their plans are running, and then walk them through their renewal process. I take it very personally. Whenever I know that there is a group that has a high Latino background, I'd like to be more present in that, in just the implementation of that case. I'd love to be out there doing meetings for these people, doing one-on-ones. In addition, I also do work in the community. I know that here in Houston, in our community, which is mainly Mexican community, I still believe that there is this misconception that Mexicans don't care at all about health. I think it is important that people know that we do care about health. We struggle with it because a lot of things in our culture don't really drive towards what we would consider a healthy way of living. But there are a lot of things about our culture that we know we need to adapt from the American culture, that are things that we can bring in that would help our community a lot more. You know, how to do exercise better and how to eat better and how to manage stress. That's also important. The other piece I've been doing this role for over 16 years, and coming into the business, I was one of the few Latinos here in this business in Houston. So many times when there was a plan that was sold, a health plan that was sold, I was asked to come out to explain to the actual employees what the benefits were like. I noticed very quickly that the Latino employees, for the most part, had no idea of how these plans were run. The concepts such as PPOs, HMOs, or co-pays and deductibles was foreign to them. It's complicated enough in English, which means that they made mistakes. They went out of network. They didn't know the procedures, and found that was a big hindrance. It cost them a lot of money. It cost the employers a lot of money. Being able to communicate a very complicated topic, which is healthcare, to somebody in their own language has been huge. I've done countless number of enrollment meetings and given speeches about benefits, and I've had number of people come up to me and say, you know what, this is the first time I ever understood my benefits, and I've had them for 10 years. I truly feel that Cigna is a company that gets what we're trying to do. I've worked for other insurance companies who say that they value improving people's health of their clients, or their value diversity and inclusion amongst their population, their members as well as their employees. But I've never worked for a company like Cigna. They truly live it. We take into consideration in everything that we do that we are doing the best for our community. We want to reflect the community that we serve. And if our community is not seeing the results that we want them to see health-wise, it's our duty to try to help them.